I am really pleased to be here, and I was thrilled when Chris Sterling asked me to chair this particular restraint reduction network. If I just give you a little bit of background, I've sort of been involved in the world of aggression and violence for probably about 20 odd years now, both in terms of being a practitioner, being really interested in the subject, but also then in researching into the subject over the last 15 years, I would say. And to be at this point today is just amazing. I think I've been trying to raise the profile of restraint and restraint reduction now for a good few years. And it's only been in the last, I would say, 18 months that it starts to feel like there's a huge momentum, a huge drive, a huge sense of encouragement and participation where everybody's pulling in the same direction. And I think this is the icing on the cake, and I think this is particularly important in order to help us all achieve what we want to achieve with regards to restraint reduction, in moving things forward, in supporting each other, in sharing ideas. And it was just great to hear when Chris suggested that this is what CPI were going to do. I have to be careful, I don't keep saying CSI. I'm a really big fan. I don't know if anybody's seen that. Crime scene investigation, I keep slipping into that. Okay, so I'm here to officially launch the Restraint Reduction Network today, which will be going live. I think really, why is it that CPI in particular are hosting this? And clearly this organisation has got a huge backdrop of experience in terms of crisis prevention. So it seems quite sensible that an organisation such as this would host this network. But in my view, they've also got what I'm calling the capacity, the reach, the ability to sustain this. We're involved at the moment I'm involved in a project called Restrain Yourself. And it's we secured £500,000 to roll out a restraint reduction model in the northwest of England with 8 of our trusts, which is really exciting. And we had actually told the funders when we got the money, because we got quite a substantial amount of money to do this, that we would set up a network. And lo and behold, we then found out that Chris was going to set this network up, so we've sort of joined up with him in some regards to do that. And what we've said we'll do with the trust in the Northwest, the Mental Health Trust that are participating in our project, is that we will fund them for the first year to be part of this particular network, to get it going, to start getting a body and a momentum moving forward. And I think the other thing is that clearly this organisation and the partners that they work with have the right sort of values and aspirations. Because when Chris asked me to take part and to chair this, I needed to feel assured that we were on the same page, so to speak. And I think certainly CPI are and will move things forward effectively, and the tools that they're suggesting that we use. And it's all about partnership working. I just wanted to mention this very briefly. And again, I'm not flogging something called the 6 core strategies, but this is a restraint reduction organisational model, and that's what we're using in Restrain Yourself. And it has a lot of ideals surrounding it. And interestingly, of all of those ideals, learning and development and leadership are some of the principles of the 6 core strategies. So it's great to know that training and working together to find out what works best, and also what doesn't work through a network such as this, is going to be really important. And so, one of the crucial things about the Restraint Reduction Network is that it's going to be a community of practice. It's funny, I've heard this term used quite a lot lately. The government have just put out a tender to look at dementia care training in the UK, and one of the things they're wanting to evaluate is this notion of a community of practice where people can work together and learn from each other remotely and also by bringing them together. So I think this is a perfect way for us to move forward in trying to make sense of what we need to do. We've got a huge journey ahead of us. We know, you've heard from this morning, we know we've got positive and proactive. We know there are things to be done. We know there are targets to be met. We know there are drivers that we are hearing, and I'll talk about some of those in the morning tomorrow. But at the end of the day, we need to be able to support each other doing this in this way. I don't know if I've ever heard This is one of Chris's slides, actually. I'm not sure I've ever heard of evidence-based practice being called sticky knowledge before. Maybe that's a new term for universities, sticky knowledge. I'll maybe go back to my dean and say, do you know that I do a lot of work on sticky knowledge? And I quite like it. I mean, it is about trying to use information and make it stick and make it useful and purposeful. One thing we do know, and as a researcher over the years, one thing I've learned, is you can do as many RCTs, randomised control trials, as you like. If you don't help people learn how to implement what you find in practice, you're on a high dinger to nothing, and it's not going to work. And certainly in the project we're doing over the next 2 years, we've partnered up with an organisation called Aqua, who are all about implementation and work with teams in practice to help them move things forward. And again, I'm sure we can all share parts of that in the network in the future. And then there's also the leaky knowledge. You know, there's things that practitioners know all the time. There's things that they learn from each other that they share. You know, you're very, very knowledgeable people, and it's trying to get the sticky knowledge and the leaky knowledge to join together. And I think our hope is that this network will help us to do that. Clearly, we're launching this today. It's hosted by CPI, as I said, not CSI. I have been asked to chair it, and as I said, I'm delighted to do it, and it's going to be open to all education, health and social care staff, which makes perfect sense given this agenda. And what it's all about is that the network is very keen to make this pledge and to get commitment for this pledge. And this is the pledge that we are making, that we want to ensure that coercive or restrictive practices are minimised. You know, people talk about elimination. There's lots of different language that gets used around the world on this matter, because this isn't just an agenda for us. This is happening all over the world at the moment. I'm very lucky to be involved in a network called the European Research Violence in Psychiatry Group. That's been running now for 15 years, and I chair that. And the agenda of coercive practice minimisation is very high on their agenda as well. So that the reach is enormous, and we are all working together. But I hope and I think that people can commit to a pledge such as this, to try and minimise the use of coercive and restrictive practices. To prevent the misuse and abuse of restraint, again, I'm sure you're all familiar with Winterbourne, and clearly we saw evidence on the Panorama programme of how restraint was being used and misused and abused. And we're not suggesting for 1 minute that practitioners out there are doing that. But clearly there are some people that step over the mark in that regard. And the network is to try and encourage and help people to be able to plan for restraint reduction. And there will be tools and measures available to you and opportunities to learn how that might happen. Okay, so there are 3 tiers to the restraint reduction network. We have the public pledge, so clearly if people want to join and want to sign up to this network, they are signing up to this pledge. Simple enough. Tier 2 is that there will be an opportunity to self-assess against a variety of measures and tools that you will find more out about in order to see where you're at as an organisation and where you want to be and how you might get there. And then there's an opportunity, as I've said all along, to share and learn the findings, the barriers, the difficulties. We know there are going to be challenges. We know there are challenges. We know there are anxieties. But we also know that people are up for this and really want to get on board and make some significant changes. That is as much as I can say at the moment, because in my capacity I am just here to, as I say, officially launch this wonderful network. Colin's just going to say a little bit more about some of the work he's been doing that might contribute to some of the evidence for this network. So I'm just going to hand over to him now. I'm assuming you will be able to, I don't know where Chris is. Where's Chris Sterling? Chris, where are you? He's not here. I'm assuring people will be available at some point to tell individuals how to sign up to the network at some point. Is that right, Rebecca?
Yeah.
Okay.
My name's Colin Dale. I think the biographies are in the pack, and so you can read that. I suppose around this agenda, as Joy shared her credentials, I suppose there are 2 or 3 things that I'll make reference to. I was the joint project manager for the Department of Health and National Institute for Mental Health on the Prevention, Management and Violence project for 4 years in the mid-2000s, following the death of David Rocky Bennett. And there was a huge initiative that we undertook that, and was the author of two things. One is the still current guidance on prevention, management of violence by the department, and secondly, the chapter in the Code of Practice of the Mental Health Act on dealing with challenging behaviour. And more recently, been involved in some specific pieces of research, jointly with Joy, as it sounds. We, in 2011, published restraint-related deaths, which we were commissioned by the Ministry of Justice to do, is why do people die in restraint? And that was a piece of work that we completed then. And we're currently involved in a piece of work with the Youth Justice Board, which is looking at alternatives to the use of pain and restraint, because you may or may not know that in the youth custody estate, there are still 3 techniques involving pain which are in use. Chris approached me and he discussed this concept of the Restraint Reduction Network. And what he was interested to do is to look at a piece of work which might help the launch and give some underpinning to that work. And this is what we've agreed to embark upon. So we at the moment are looking at what the literature is out there on this whole area about restraint reduction, and look at not only the investigations that are being done, but the quality of those investigations and whether or not they're of a sufficient sort of standard, if you like. And to do that, we've defined, I don't intend to go through all these, you'll have the slides, but we've looked at the criteria that we would use to include in that sort of study. And we're pretty much, I would say, 2/3 of the way through this at the moment. And what we've been able to identify currently is 11 systematic reviews that have been done. Now, without going into all the technicalities of that, these are fairly robust studies that have looked at the literature and suggested what are the most robust findings from those. And so this work is going to be what we'll call a meta-analysis, if you like. We're going to look across all 11 of those systematic reviews and saying thematically, where are the sort of big issues which actually are proven to have a direct effect on restraint reduction. And from that, we want to make that available to the Restraint Reduction Network. In one of their early meetings, they'll be the recipients of this report, which will provide that analysis. But the phase 2 of that project would be the development of what we're calling a checklist, if you like. It will enable services to actually measure where they're at with regard to current known knowledge on restraint reduction, whether or not you have adopted those techniques, whether or not there is more work for you to be done as an organisation. And what we want to do with that checklist is, I think it's got a number of potential uses. One is a self-assessment for people who are signed up for the restraint reduction. So we envisage you being able to go online, to be able to go through that and actually self-assess where you currently are in relation to the implementation of restraint reduction strategies from all the available research which is known internationally. The sort of next step on from that, and again this is for the Restraint Reduction Network, that the group that Joy shares, to decide how to use that. That's the most simple use of it. We have envisaged that you could actually use it one level on beyond that and use it as a peer review system. So you could match services up. Any of you involved with AIMS, which is run by the Royal College of Psychiatry, or a number of networks, where they'll use people who are working in services similar to yourselves, who will come and peer review your service against that checklist, which would be more robust, if you like, than a self-assessment. I think anybody externally might say how robust would you be on a self-assessment, whether or not you'd actually be a bit more forgiving of your assessments. With a peer review system, there's people outside your current working area coming in and providing feedback about where you currently stand, and perhaps other things done. And I think that peer review might offer a higher level of assurance, if you like, that people could sort of commit to. So what we'd like to try and do with this body of knowledge and body of work is to use this as an early game, as an inducement, if you like, of, well, why join the network? What's in it? Well, one of the things going to be in it is you're going to have access, if you like, to the best current research internationally in relation to restraint reduction, and an ability to benchmark yourself against that, and potentially benchmark yourself against other services. We'd hope to now have certainly a literature review available for Joy's first meeting, so that meeting will actually be able to consider the report produced, and then consider how that can be best used to drive into this assessment network, which would then be available to participants. As Joy's saying, the 8 Northwest Trusts will have access to that because through her current project, they're having that first year membership made available for them, really. But it's an encouragement, if you like, an inducement about what might be useful about growing. And we'd hope that other products would grow from the network and be made available to participants. And I think it's the CPI's credit that they've taken the initiative to actually drive this forward on a national basis. So I'd wish to commend them on that. So unless there's any direct questions, I think we're about 2 minutes off our completion time. So with that, as I say, we've launched this. Again, these overheads, I think, are going to be made available to people if they want to sort of access and read through those. And certainly the product, which should be with us in the next 6 weeks, again, should be made available through that network for you to be able to read what the literature is behind that, and then the next product on which will be the checklist. So thanks very much.